A very pleasant good afternoon to all of our viewers, and welcome to another edition of Let's Talk. We are delighted that you have joined us this afternoon, whether you're listening via Second Advent Radio, or you are following us on our YouTube channel, via SLC Church channel or SLC Adventist. We welcome you just the same and trust that our discourse for today will prove meaningful. For the last several weeks, we have been discussing taboo issues relating especially to female, not exclusively, but especially to females. You know, I have been urging the males to listen in, especially to issues related to the female anatomy, breast cancer. And today we're going to be talking about the power of the cervix, understanding cervical cancer. This is a topic that all ladies, for sure, and men likewise, because, you know, if you're married and your wife is impacted, if you're a male and you have a sister, you have a mother, they're impacted, it is important for you to have the information. So we trust that the information presented will prove meaningful. On Let's Talk, we discuss issues that impact the church and the wider community. And today, as indicated, we are discussing this whole matter of cervical cancer. We have a very special guest with us, but before I introduce our guest, I would like to invite you just to have a word of prayer. Eternal Father and our God, thank you for the opportunity, the privilege to share on Let's Talk. We are discussing a very important subject, and we pray for your wisdom and your guidance. Be with our guest in a very special way. We thank you for giving her the wisdom and knowledge to be able to share with us this afternoon. And wherever around the world people are listening, we pray that you will grant them understanding. In Jesus' name, amen. So friends, again, we are this afternoon discussing cervical cancer, and with us to discuss this very important subject is Sherry Tulu. She is a medical professional. We are delighted that she has given the time. We know that medical personnel are always very busy, and for her to be able to give us of the time, we are extremely delighted. She is an obstetrician and gynecologist at Mansour Medical. Dr. Tulo, we are delighted to have you. Let me just say a little bit about her before I bring her on. As indicated, she is a graduate of the University of the West Indies. She also completed postgraduate training in obstetrics and gynecology. She has been a doctor for a number of years and currently serves as a consultant obstetrician and gynecologist at the Sir Lester Baird Medical Center and also Mansour Medical. She, by the way, is also the chair of the Cervical Cancer Task Force in the Ministry of Health and Wellness here in Antigua Barbuda. She has served women across the Caribbean and is passionate about women's health. So we are extremely delighted and pleased that she is here on Let's Talk. And for the next few moments, we are going to be discussing this important subject of cervical cancer with her. Good afternoon, Dr. Tulu, and welcome to Let's Talk.
Thank you so much, Dr. Greene, and thank you for having me. I'm always happy to be a part of these discussions.
All right, we are so delighted that you are here with us today. We're going to get right into the discussion. Now, before we get into cervical cancer itself, let's first talk about the cervix. What exactly is it and what role does it play?
So the cervix is the lower part of the womb or the uterus, depending on the term that you use. And everybody, or most people, know the womb because that's where babies grow, right? So people are more aware of the presence of the uterus during pregnancy. For women, it's also we have monthly reminders because it's also how we have our menses every month, right, during the reproductive years. So the cervix is the lower part of the uterus or the womb, and it actually serves a lot of functions, right? So it actually serves as a barrier So if you think of it like a door or a tunnel that stays closed, it prevents infections or organisms that can become infectious that live in the vagina from gaining access inside the womb and causing an infection inside, right? Which can be very serious and can affect women's fertility, and sometimes can even cause women to have to be admitted and get antibiotics, right? It also is a mechanical barrier, meaning that, or I should say it serves as has a mechanical function, I should say, because it's also stays closed to allow pregnancies to progress over the time that it should. So a healthy cervix stays closed and allows a pregnancy to go to term. And then you have your healthy baby at the end, right? But those are the main functions. But the cervix is also a pathway, I should say. It's a pathway through which, of course, women's menses, the blood would come down. The lining that's inside a shed comes through the cervix, and then that's how, we experience it as menses. It's also how sperm would gain access and go up to then meet the egg and result in fertilization and pregnancy. So a very, very important part of our bodies that we should know about.
Now I'm talking to you about this. I have come to realize that there are, surprisingly, in 2023, there are still a number of persons who do not have very good knowledge of the human anatomy. And I believe it is important for females in the first instance to understand their bodies and to know how they function. But I also think it is important for males to understand that. This question just came to mind, so I'm going to ask you, why might it be important for a man to understand about the cervix and its functions?
Well, I suppose it's important for him to understand how his partner is affected, or how so the reality is that when it comes to the topic of sex and sexual intercourse, everything that occurs between the man and the woman affects the woman in some way, right? So it's important for him to understand that impact, and and that goes not just from the actual act and the experience a woman can have during sexual intercourse, but it also goes on to how she gets pregnant, or how she protects herself from pregnancy, depending on what you're trying to do, and even just infections. One of the common things that women will seek medical attention for are vaginal infections, and vaginal infections are, sometimes just have to do with the balance being thrown off, and sometimes that can happen during sex. So it's simple things like that, so when she goes home and she has this discussion, it's important for him to understand, and, also not make her feel like it's her fault, because it's not, right? And even with just what we're talking about today, and we'll later speak about the issue of infection with the human papilloma virus. So we just conducted a pilot where we introduced HPV testing, moving away from pap smears alone, but improving our screening using HPV testing. And one of the hard discussions women have had to have is if you have a positive result, is going back now and having that conversation with your partner. What does this mean? And him not understanding, because a lot of times the men don't come to those visits and get to be a part of the discussion and the counseling. And so women feel alone. They feel alone when they're going through these experiences just because the man doesn't understand. So it's really important for men to understand what's happening to these ladies in their lives that they say are so important.
All right, that's very interesting, and I hope we have time to come back to that, because there are a couple of things you said there that I want to follow up on. But I want to make sure that we go into the substantive area. So let's go here now. We want to talk about cervical cancer. And based on what you have said, it appears to me as though when we talk about cervical cancer, we are in fact talking about the cancerous growth in that region of the reproductive infrastructure of the body. Now, how common is this form of cancer? And particularly in the Caribbean area where you function.
Okay, so in the world, cervical cancer is actually the fourth most common cancer affecting women, right? Disproportionately, countries like ours and the Caribbean, the developing countries or the developing world, we bear 90% of that burden. So it's more common in our countries than it would be perhaps if you go to the US or the UK or Australia. In Antigua and Barbuda, the data that has been published indicates that it's the second most common cancer being diagnosed in women. For, of course, only surpassed by breast cancer. That may or may not have changed by now because some of that data is not as up to date as I'd like. But given what we experience at the hospital, and it probably hasn't changed much. So it's the fourth most common cancer affecting women in the world. Here in our Twin Islands state, it's the second. And it's the third most common cause of death from cancer amongst our women. So unfortunately, it's more common than we'd like.
Now you did indicate that we bear a greater part of the burden in terms of where we are located. Why is that so? Is it lack of information? Is it lack of availability of medical technology? What is contributing to these very small islands, our territory, having such a high rate in comparison to the rest of the world?
Well, unfortunately, one of the most common things is just having the structure in place, a good screening structure, meaning that women are invited to come and screen. If they don't show up, they're followed up. And of course, just the whole right along the length. If you do your screening and you're positive, you're contacted, the time that it takes to get results back. And again, that all has to do with how well the system can support the process that is necessary to, one, provide all the services, right? So when we talk about prevention, it's not just about screening, we talk about vaccination, which I'm sure we'll talk about later on. But you have to have a good system of vaccination. And unfortunately, in all our countries, we have low rates of vaccination. And the issues behind that might be complex, having to do with, one, people's understanding and knowledge, but also just certain things that are cultural and perspectives that we have that are basically barriers to persons seeking care. And also some of it is socioeconomic. So it just has to do with the socioeconomic reality of the women that are involved. So even if you look more closely in each country at the women who are being affected, you're going to find that, it's more common to see some of these cancers and just low screening rates amongst women who have a lower socioeconomic status, right? Just because, again, knowledge, knowing that they need to go and get these screening done, being able to find the time because they're so busy taking care of their family to go and see the doctor, even when they're having symptoms. So it's complex. It's really complex.
Sorry, I was muted there. You mentioned just now, or already, I should say, the whole matter of, and I know we're going to get into the details of HPV, but based on what you have said, I gather that HPV, the human papillomavirus, has something to do with cervical cancer. So let's talk about that a little bit. What is the cause of cervical cancer and what are the risk factors?
So you just said it. The human papillomavirus is actually the cause of almost all our cases of cervical cancer. It is rare to develop cervical cancer without the presence of that virus. And that virus is very common, right? So without exception, regardless of the circumstance in which someone will become sexually active at some point in their life, almost all of us get exposed to that virus, right? So exposure is common, right? And there are many different types of the virus. That's another thing persons should know. HPV is not only common, but it has many different, almost 200 types of it. But of those 200 types, 14 types have been linked with the risk of developing cancer, right? And the reality is that persons won't know which ones they get exposed to once they become sexually active, which is when most people will get it, right? So a few months or years after they become sexually active, persons are usually exposed to the human papillomavirus. And that's the key risk.
I'm sorry to interrupt you, but I do want to drill down on something you mentioned there. We're talking about the period of sexual activity for women. If a woman never has sexual intercourse in her life, and she gets the HPV virus.
So if there would have to be a mechanism for the HPV virus to have been able to gain access to the cervix, and that means something would have had to be introduced in the vagina to be able to get to the cervix. So so for a woman who has never had sex in her life, her risk is going to be a lot lower for getting the HPV and going on to develop cervical cancer. The reality is that's not very common, right?
So we're primarily talking about the virus being transmitted through sex.
Correct. And other thing that we should, I know we're talking about cervical cancer, right? But the HPV virus is common in our environment. It exists on surfaces, surfaces of of people, right? Because it's skin to skin contact. And what is unique about cervical cancer is that HPV would be introduced in the vagina and gain access to the cervix to infect the cervix, right? So it's because the cervix is uniquely susceptible to this virus. So when you talk about, there are other cancers that the virus will cause, can cause, anal cancer, vaginal cancer, vulval cancer, throat cancer, penile cancer, right? So, it can cause cancer in other areas as well. But for it to get access to the cervix, we're talking about persons after they become sexually active.
Okay, so I did ask you about the cause, and I did also ask you about risk factors. Now, perhaps you did go on to explain that, I can infer, but
there are other things, right? So when we talk about risk factors, we know what causes the cancer. It's this virus. But then there are factors that will increase someone's risk of being exposed to that virus. And that has to do now with persons who become sexually active early in life. So this is where we start having conversations, especially with young people, to say, hey, this is another reason why we should, we encourage young persons to, leave this particular, leave sex alone until they're older and entering into sex in a responsible way. But also we talk about things like having more than one partner, and that can be not necessarily at one time, but even over the course of time, right? So, people move on from relationships. And reality is that you can get HPV from anybody that you've been with. And HPV can live in your body for a really long period of time, 10 years, 15 years, right? So we're not, so you could have only had 2 relationships in your entire life, but it doesn't mean that you couldn't have been exposed to HPV in a substantial way. if you have a partner who has multiple partners, which is unfortunately a big part of our culture here in the Caribbean, right? Especially for women and men, unfortunately, we have a culture where men, it's embraced that, you know, you have multiple partners. So that just means that you may have one person as a woman, you know, and may have one partner, but that partner has multiple partners. That's going to increase her risk of being exposed to a high risk type. Not using barriers. So not using condoms means that, of course, you're going to have more exposure because there's more there's more contact, right? Also, a man not being circumcised, that increases the risk of her being exposed because studies have found that men who are not circumcised take longer to clear HPV if they have it than men who are circumcised. Things like smoking, right? Having underlying conditions that affect their immune system. So persons who have things like HIV, or we could talk about things like just having uncontrolled diabetes, right? Or persons having certain autoimmune conditions and having to be on medications that suppress their immune system. It means that when you get exposed to the virus, you're less likely to clear it, right? And we've also found that women that have what we call high parity or have, you know, maybe 5 children or more are more at risk for not only being exposed to the HPV, but that can impact their ability to clear the infection once they're exposed to it. And that's a complex thing, but that's also a risk factor as well. So those are some of the risk factors. The other one is having other sexually transmitted infections. Think of them as friends, you know, they help each other, right? So having other sexually transmitted infections make it easier for HPV to gain access to the cervix and cause infection. So
if a man and a woman are married and she is committed to her husband, one partner, but he has 5 others and she doesn't know about, she effectively is exposed to all these other men.
all the other women that he's with.
All the other women, yes.
Yes, correct. They become one. Think of it like a network, you know, so you join the network.
Yeah, I deliberately asked that because, you know, you come across so many circumstances where men, I find, unfortunately, some men, I should say, I don't want to be too general in that, but some men believe that it is acceptable, it's okay for them to have multiple partners, but they're not very excited or even willing to entertain the thought of their spouses doing the same thing. So we're talking about equal responsibility here.
Yes.
Yeah. And then you mentioned early sexual encounters. You know, people waiting until they are responsible enough. I sometimes wonder, in spite of all the education, in spite of all the information that we have available about contraceptives and the like, and protection and the rest of it, how come we still have so many teenage pregnancies? That does show that people are not heeding the information. So it's worth saying again that people ought to be responsible. We're talking about something that can kill people. Am I correct?
Correct. I would say, Dr. Greene, that society sends, I mean, while there's a lot of, we live in an age where there's a lot of access to information, there's also a lot of access to things that promote basically bad behavior, right? So we talk about, we live in a very, unfortunately, very sexualized society where everything, you know, it could be a commercial for something on that has nothing to do with sex, but, you know, it's brought in. Our children, unfortunately, are exposed to this topic a lot earlier than, as a parent, I would like. You know, it's you know, no matter where you turn, you know, they're being exposed. And so even though their information is there on how to protect yourself, we're not having those conversations enough with our children, and helping them to, and combating the bad sources of information that's out there. and the negative things that promote irresponsible behavior. Unfortunately, we're not combating that. And it's a reality that we live in.
Yeah, it is unfortunate that, and sometimes I wonder that, we allow our airways, the media, we allow certain things almost uncensored, and you wonder why. So the exposure is there. You drive along the road, the billboards, everything. It's a sexualized society. And then we wonder, why do we have the challenges that we have? But that discussion is for another time.
Yes.
Let's move on. Now, you said a bit about this human papillomavirus. I do want to ask you, though, about treatment. How do we treat this? Before that, because I used to hear that cold sores are when people have this HPV, it sometimes manifests itself. No, that's
usually herpes. It's a different virus. They're friends, but that's usually caused by the herpes, the herpes virus, herpes simplex.
Oh yes, that's
which is another common infection that I just want to tell you, Dr. Greene, the reality about these infections is that most people have it and they'll never know. There are no signs. People keep waiting on signs. A lot of people that have the HPV will never know unless they're doing checks, because it doesn't give you signs earlier on. Same thing with the herpes simplex virus. No signs. Most people who have it don't have any symptoms. We don't know that they have it. Yeah.
Okay. Now, I do understand that.
Treatment.
Sorry?
We're asking about treatment.
Yeah, before I get to treatment, there is something else I wanted to back up a little bit, because I understand there was a break in transmission some time ago. I hope that everybody's hearing. I hope we are coming through clearly. I think that yes, that's good now. So when I counsel people, premarital counseling, when a man and a woman comes to me for premarital counseling, one of the requirements, and this is something I notice, marriage preparation, that's another discussion, but one of the things you try to do is to get people to understand responsible behavior. And based on people's past lives. Now, we don't want to assume anything, because sometimes people say, oh, I'm good, and they have a history. So one of the things I require them to do is to go get checked out. Go to a doctor, let them know you're planning to get married and your counselor has asked that you be evaluated. Now, I expect that to include things like HIV testing, because it is unfair for a couple to get married and one doesn't know that the other is infected. But it seems to me as though it's good now to say check also for HPV.
So I agree with you, except that there's no tests for men right now, at least not that we do here. So you have tests for women, but you don't have tests for men. And
why is that so?
So the reality is that in terms of the technology, and finding something that's acceptable for men, I suppose that's been a challenge. Just thinking of where it would have to be introduced. Okay. But part of it has to do with the reality is that men are not affected by HPV the same way women are. So cervical cancer is way more common than penile cancer. And so the focus has been on knowing a woman's status, because you're trying to protect her, right? Than testing the men. Because when you talk about investment in the development of technology, it has to be that it has a purpose, right? And when you test a man, you're not going to do anything. You're not going to do anything. It's good to know, but you're not going to do anything about it. Whereas for a woman, if you know she has it, you can do that. There are steps you can take to protect her. So it has to do with just a bigger picture. Why the focus has been on women being tested are not men. So unfortunately, in that discussion, it's good for a woman to know her status, more for her, just to know, as opposed to, she won't necessarily know her partner's status, unfortunately.
Okay, and that's very interesting. But now let's talk about treatment. We were talking about that before. Yeah. So how
There's
treatment?
no treatment. So there's no treatment for HPV infection. So we rely on our immune systems to clear it. So just like when you get the flu, right? So most people, when they get the flu, you take your vitamin C, your zinc, your vitamin D, and then, you drink lots of fluids, support the body so that while the body is fighting it. It's the same, similar. It's, so we rely on our immune systems to clear the infection. Unfortunately, for persons that have good immune systems, 90% of people will clear it. Most people will clear the infection on their own. What we can treat is what the virus does. So if you haven't cleared it, it starts to cause changes in the cervix. We can treat that. We can clear what it has done while your body is getting rid of the virus. That's what we can do. And in treating the early changes that the virus can cause, we prevent women from going on to develop cervical cancer.
So can you talk about that a little bit, between being infected with the virus and developing of cervical cancer? What are the stages? What do you detect? How do you know, etc.?
Okay. All right. So I will first say that it can take up to 15 years for someone to go from getting the infection to developing cervical cancer. On average, you're talking about 10 to 15 years. So there's a lot of time for us to pick up that something is happening and treat the changes caused by the virus, right? Or monitor someone very closely. Now, if I might say anything good about this particular cancer, is that it gives us a tremendous amount of time, and it warns us, right? So there's a stage before cancer called pre-cancer. And if we can detect women in that stage, we can treat the pre-cancer and prevent a woman from going on to develop cancer, right? And the pre-cancer, generally we talk about it in 3 stages: mild, moderate, and severe, or 1, 2, 3, right? And most persons who end up having the changes because of the virus and have mild changes, their body can generally reverse that as it's clearing the virus, okay? But if you don't, then you can go on to have moderate and severe changes, right? Moderate and severe pre-cancer changes. Some women may still be able to reverse that, but you're less likely to than when you had mild changes. And in that situation, we definitely talk about treatment, okay? So those are the women that we generally treat, women who have moderate or severe pre-cancer changes. And in treating those women, we prevent them from going on to develop cervical cancer. How do we identify a woman who is at risk for developing those pre-cancer changes? Is by either one. Most women are familiar with the pap smear, and a pap smear is basically we just take a surface brush of the cervix and we look at the cells. We look at the cells and we say in the lab, and they look at it and say, this cell looks like it's starting to have those changes. The doctor needs to get a closer look. The other test that has been introduced in recent times, and we now have access to in the public system now, is the human testing for the human papillomavirus. So a virus has DNA, just like we have DNA. And if you can know that a virus is present by the presence of its DNA, right? So again, we do the brush of the cervix, just like with a pap smear, but instead of looking at the cells alone, we now look at the virus, look to see if the virus is present, because we know that the virus has to be present for someone to develop the cancer, right? And that test has been proven to be a lot more sensitive at picking up a woman who is at risk for having those changes. And so once we know that a woman has that virus, and we're only talking about the high-risk types that cause cancer, we're not talking about all 200 types. We're talking about the ones that can cause cancer. If you know a woman has that, or we're looking at the cells and the cell looks really abnormal, then we know we have to take a closer look, right? So we call women back and we say, hey, we need to take a closer look and see what's really happening. And the name of that procedure is what we call colposcopy. It's a tongue twister for most people, right? But basically all we're doing is that we're looking at the cervix and we're getting a magnified look. And we put certain solutions on it and we try to identify the areas that might be having changes. And we do what we call a biopsy, right? Which is just a small, we just take a little bit of tissue from that area and then we send that to the lab. And then we know for sure if the woman is having those changes. And if she is, depending on the stage, like I said before, if it's moderate or severe, we treat her and we monitor her closely after. If the changes are mild, we still keep a close eye on her to make sure her body clears the change and clears the infection, and that she's not going on to develop more serious changes that need to be treated.
So are you now, you're talking about the examination, looking to see whether there is structural changes. What determines if you do that test versus just the pap smear?
So right now, the recommendation is that every woman who is 30 years old or older should have an HPV test done, right? So not just a pap smear. She can do it with the pap smear if she wants, but at the very least, she should have testing for HPV. The reason we've decided to, or most guidelines recommend that age group is because we already know that HPV infection is common. But we also know that most people who get it, and the most common time to get it is when people become sexually active, which tends to be in their 20s. So we know that if we test everybody in their 20s, most people are going to be, going to get a high positive rate. But it doesn't mean those people are going to go on to develop cancer. We know that most of them are going to clear it before they get to their 30s. If you get to your 30s and you haven't cleared that infection, then that's when you become at risk, right? Because it means that you haven't cleared it. The virus has now been given an opportunity to cause these changes. And so we focus on HPV testing mainly after the age of 30. Screening, however, begins at age 21, right? We use pap smears, until you get to 30. We use pap smears alone to screen women.
So how often?
So you did ask, how do we do all these tests, how do we know? So for pap smear, there are certain results that are just abnormal. And if it's abnormal, then we send you on to do more testing, which is what I had described earlier. For HPV testing, if it is positive for a high-risk type, then you're going to you either end up doing a pap smear as well, depending on the type of HPV. So we know that even within the group of HPVs that can cause cancer, there are like 2 or 3 that is more likely to cause cancer than the others. So when we see those types, we go straight to taking that closer look at the cervix. But we know that the other types that can cause cancer do it, but to a lesser extent. And so in order not to subject women unnecessarily to these procedures, we would use a pap smear to help us decide if she needs to go on further. So that's what we have been doing.
Okay, so we have a couple of questions from our viewers. I just wonder, I think we spoke to these already, but somebody may have joined late. So I'm going to ask still. This one is asking, is sexual intercourse the paramount contributor or factor to the risk of cervical cancer?
if it's a, what did you use a while ago?
Paramount contributor.
Yes, so yes, once people become sexually active, we know that within months or a couple of years, most people are going to get the human papillomavirus and be at risk, therefore, for cervical cancer.
Okay, the other question I think you just answered, so it may not be necessary. They're talking about the pap smear and whether it's the way to detect early cervical cancer, but you just spoke to that, so I don't think it's necessary for us to.
Dr. Greene, sorry, I want to still address that.
Sure.
People think that we do pap smears, and in this case, we also speak about HPV testing to detect cancer. We're not trying to detect cancer.
Mm-hmm.
We are trying to detect women who are at risk for developing cancer. So people think that when they get a positive result, they have cancer. You don't have cancer. It doesn't mean that you have cancer. It's not impossible that sometimes in doing these tests, we actually pick up women who may have cancer and just didn't know. But majority of the times, what we're doing is identifying a woman who is at risk, identifying a woman who may have changes that are occurring that need to be treated to prevent her from developing cervical cancer. So that's just an important thing I need persons to understand. We're not trying to detect cancer, we're trying to prevent it.
Now this question is kind of interesting. You mentioned earlier, I think when we just started, that HPV can cause cancer of the throat as well.
Yes.
We know that women, you did indicate that women are the ones who are tested, not the men. If a man develops cancer of the throat from HPV, what are the implications? What does that say? Is it if he has it, if he has because he does not know whether he has HPV because there's no test for the male, can the HPV in a man cause him to develop throat cancer on his own, or is there something else that is going to lead to that?
So the reality is that in our general, in terms of sexual practice, we have many different combinations now, right? One of those, we talk about oral sex. So the reality is that that also, that is basically, that's an exposure point, right? So if one partner has HPV in a genital area and you have oral sex, then it can be transmitted now to the oral area. No, it doesn't mean that you have to have oral sex to get that. It could have been that a partner you had before may have engaged in that, but you only kiss them. But guess what? That person has HPV in their mouth, but you don't know that. We don't do testing of people's mouths for HPV, right? So the reality is that it's hard to say where or how people pick up some of these infections, which is why, sometimes we just, it's to have those conversations are difficult and sometimes not very helpful. The reality is, once you become sexually active, once you start engaging in kissing, I mean, again, you don't know if the person you kissed or the person you kissed doesn't know if the person they kissed before engage in something and may have HPV in their mouths, right? So so it's hard I'm not sure in terms to say what it says about the person, right? The reality is that all of us are at risk for those, right? Okay. And we have to therefore know, we have to accept that we're all at risk. And then beyond that, you now have to start thinking about what can I do to decrease that risk, and that's basically where you have to focus your attention.
Yeah, that's quite interesting. We don't have time to go into some of the ramifications of that, but very interesting. So let's get back to cervical cancer itself. We understand the cause, we understand the risk factor, we understand that there is this precancerous thing that gives people time to take action. Now, the signs and symptoms. So when a person moves through that precancerous stage, let's say an individual who did not go to the doctor regularly. By the way, how often should a woman go and get her
That's a
screening?
good question. I'm glad you asked. So pap smears should be done every 3 years. If so, right? So if you're only doing pap smears, you should do it every 3 years. With the introduction of HPV testing, if it's done in combination with a pap smear and both are normal, then you can actually go up to 5 years. Or even if you do the HPV test alone, once it's negative, meaning you don't have a high risk type, some guidelines will, and even for us here, we've been using 5 years before you do your next test. So, yeah.
Okay. So now, if a woman did not take advantage of the testing and she does develop the cervical cancer, what is the chance of treatment, recovery, etc.?
Okay, so the first thing I want to just highlight is that a lot of times in the pre-cancer stage, and even early cervical cancer gives you no signs. So if you are waiting for signs and symptoms, unfortunately, by the time you see that, it may be well advanced. Okay? So the most common thing is that the early stages of cervical cancer and even the precancerous stage, most of the times there are no symptoms. What you may see or you may experience and should not ignore, and this doesn't, and I will go through them, and it's very important that women understand that while I'll describe them, it doesn't mean you have cervical cancer. There are other things that can cause some of these symptoms. So we talk about things like bleeding in between your periods. That could be caused by hormonal issues, related issues. Could be caused by a polyp, which is not cancer. A polyp just being an old growth, Could be caused by infections, other infections, not necessarily HPV, right? But it does always mean you should get it checked. So bleeding in between your periods, bleeding after sex, heavy periods, right? Or just heavy bleeding, even if it's not a period, because some women do experience that. They just bleed heavily and for long periods of time. Having pain in the lower pelvis, which can be caused by fibroids and endometriosis, but again, something that you can see in cervical cancer. A discharge that is, especially one that's offensive, which again could just be caused by an infection, but we do see it in cervical cancer, right? A persistent vaginal infection or discharge, which is why, again, don't just go pick up things over the counter, always see a doctor, so a proper examination can be done. And so pain in the pelvis, I spoke about that. And as it gets more advanced, you start to see, you may experience other things like sweating at night, weight loss, things like that. So those are perhaps the more common things, ways that it can present. But again, a lot of times by the time you're seeing some of these things, it's further on than we would like. Now we talk about treatment. We offer treatment at every stage, right? There is treatment for every stage of cancer, but we talk about achieving cure. And the ability to achieve a cure is harder the more advanced the cervical cancer is, okay? So if you ask me as a doctor, when do we prefer persons to present? We would prefer if they presented before they developed the cancer. But once you've developed the cancer, the earlier you present is the easier it is for us to achieve a cure, and the better we're going to be able at keeping you well for a longer period of time and preventing the cancer from either advancing or returning. So the advice is always that, one, you should be seeing your doctor regularly, right? And for women, we speak about doing well woman visits. So you're not waiting till you feel sick to see your doctor. You're going every year, seeing your doctor, doing your checks. Even if you don't have to do a pap smear every year or an HPV test. The reality is no test is 100%, but these tests are highly effective. If for whatever reason, a woman does her test, but it's normal, but something is happening, if you're seeing your doctor every year, you still have the opportunity to pick up things that are going on. If you're seeing your doctor, then your doctor will be able to examine and see. Remember, you can't see your cervix, okay? And those are some of the things that you can do to help protect yourself and detect the changes or cancer early.
Now, our time is going quickly, and I do want to get into two things which I think are really very important. So let me ask this with respect to, and I think it came out of something you mentioned earlier about risk reduction. I believe you did say that most persons should clear HPV if they're healthy, if they're strong. So when we talk about risk reduction, to what extent lifestyle practices in terms of diet, in terms of exercise, in terms of one taking care of his or her health, help in this matter?
Right. So that's very important. So like you said, most people clear it in the first year or two of having it. But you have to have a good immune system to do that. You also have to have a healthy you want to have a healthy cervix as well, or you want to keep that environment as healthy as possible. So we talk about things that you eat, and your lifestyle practices can affect your vaginal health, right? So if you're eating a lot of sugars or refined carbohydrates, so like the breads, the rice, those things are not very good for your immune system, and they can affect person's balance in their vagina. There are some women who find when they eat a lot of sweets or they eat certain foods, they get yeast infections, things like that. And just basic, it's probably more related to avoiding things that have a negative impact on your immune system. So alcohol, the smoking, those things that also affect your immune system. You want to avoid those. You definitely want to avoid those.
All right. Now, on the news the other day, I don't know if it was on the radio or I read it in the newspaper, but there is this, I actually got a few calls about it as well. There is this proposal that they're going to be, I think it's just a proposal about the vaccine for making it mandatory. I know that's a little controversial because some persons think, why give young children this vaccine? Could you explain what this does? What is the intention? What does the vaccine do? How protected is a person if they have this vaccine?
Okay. And I know when people hear things like mandatory, it automatically builds barriers.
Yeah.
But more importantly, we like to build bridges using education. So we want you to have all the information. So let me start. Remember, all of us basically are going to get this virus at some point in our lives. This virus is very good at evading your immune system. So it hides in your cells, make sure your immune system doesn't see it, and it hangs out there. And so, usually once you get exposed to an infection and your body sees it, your body starts to build an army, right? Your body never forgets, and it starts to build a little armamentarium so that the next time it comes, it's going to clear it. And it also mounts an immune response to clear it at the first infection. But because of the virus and how the virus behaves, that's not that's not always a very strong response, right? And so to improve people's immune response when they're exposed to the virus, what you want to do is, it's kind of like, like when you have a wanted person and you should have a picture. You show a picture so that if anybody sees them, they know what to do. It's similar. So what you do is how the vaccine works is that it basically takes a picture of the outer part of the virus and it shows your immune system. So when you see this, the immune system knows when you see this, it's the HPV, and you make sure you're ready. So it shows, if you give it to your children long before they're exposed to the HPV, you've given the immune system a chance to build that army so that when your children get older and they're exposed, the body is ready and it's going to clear that HPV and prevent it from infecting the cells, right? And remember that you're not just protecting from cervical cancer, you're now protecting your children from any cancer that's caused by HPV, right? So that's the other thing that's really important. This vaccine has been around from 2006. More than 250 million doses have been given all over the world. Countries like Australia, who introduced it earlier, are already seeing up to 70% reduction in their pre-cancer and cancer rates. Countries like Rwanda have already achieved 93% vaccination of their girls and are therefore on their way to eliminating cervical cancer. And Rwanda had one of the highest rates of cervical cancer prior, right? And so it's really important that we make sure we have all the information. It's been proven to be safe, right? And it's been around long enough for us to be able to assure persons of that. We've been giving it here in Antigua since 2018, and we haven't had any serious reactions to it. So we have had a good experience as well. But that is how we're going to protect our girls in the future from cervical cancer. And that is how we can protect our entire population from any cancer that's caused by HPV. It's our best way of doing so. Nothing is 100%, but you'll get to about 90% using the vaccine and then going on to do your screening later on. And we will find out less of our children, well, of course, they're not going to be children at the time, but when they get older, less of them have to be going to doctors to have treatments for pre-cancer, even warts. So the vaccine doesn't just prevent cancer, it also protects our children from HPV warts. So the HPV types that don't cause cancer, some of them cause warts, and it's covered in the vaccine. So that can be, distressing later on in life, and it protects against that as well. So I am definitely one who encourages it, but I do believe that it's important for persons to understand that it is helpful, and it's our best protection.
Well, guess what? Our time is up. It really was a pleasure talking with you. There are a couple of other questions I would have liked to ask you, but time would not allow. So before you go, however, somebody listening might want to do some follow-up with you, might maybe want to contact you. Can you do you mind sharing your information?
Oh, certainly. So I mean, I work at the Sir Lester Bird Medical Center, but we know, that's a referral center. So I would first like to encourage persons to, in terms of screening, please go to your clinics, get your screening done. And if you need to come to us, we're all there. We have a wonderful team waiting to look after you at Sir Lester Bird if you need to have that done. Other than that, I'm at Mansour Medical. And we are on Facebook, we're online. So you can always find our numbers and I'll be more than happy to look after you there as well.
Well, thank you so much, Dr. Tulu. It was a pleasure talking with you. You have shared so much information, and it was really refreshing. We appreciate it. Hope one of these days we can have you back and let's talk for another discussion on something else.
Thank you, Dr. Greene.
It really was a joy. Well, friends, next week, just before we go, I want to let you know that we did, when we had our first or second discussion, we were talking about the menstrual cycle, and we also spoke about sexual dysfunction. We did not get an opportunity to go into the male sexual dysfunction. I'm happy to let you know that next week we're going to be talking about sexual dysfunction in males. So next week, that's what our discussion is going to be. 3 o'clock, same time. That's all for now. God's blessings.